So, Chrissy, I started this yesterday. Okay, spring cleaning. So we've got the spring cleaning, we've got the pollen in the air.
Yes.
Oh my goodness, so that's why we're all sneezing, and that's why some of us feel like we're sick. Dr. Chaffoo in the house, he's gonna help us get through our spring days, right? So talk to me about these allergies and some of the popular agitators.
So the big popular agitators are things year-round would be dust and the dust mite, but right this time of the year it's going to be pollens from the grasses and the trees. This is why we're seeing this increased pollen count. We're seeing more symptoms with patients now.
So how do you fight this then?
So the best way to fight it is, is prevention. First of all, there's some common things that we can do, household tricks that can reduce the pollen count, reduce the dust count.
Okay, so we have, this is one way, right? Allergy proofing your day.
Yes.
Keep your windows shut, you say?
That's a great point, because see what happens is, Kristina, the pollen count is highest early in the morning. So for those of us that suffer from pollens, if the windows are open at night, it allows all that pollen to seep into the house, and that's why we have our symptoms worse in the morning time.
And you say sport shades too.
Sport shades are really helpful if you're out running or out exercising. They'll will actually block that pollen from getting into the eyes. Something I didn't realize is how important it is how you actually clean your washers or dryers.
Yes,
for
like this.
example, with these, because what happens is the inside of a washer, unfortunately, is a warm, moist environment. It's great for funguses and bacteria. So we recommend cleaning the inside of that at least once, if not twice a month, with a cleaner like some sort of a sanitizer. And if you have any allergies where you don't want to get exposed to it so much, great idea to put a surgical mask on, to wear gloves, wash your hands afterwards.
But just use one of these wipes and wipe the inside.
Wipe the inside, clean it.
And then I saw this and I asked him, are these good to use?
Well, they're good to move more of the dust around, unfortunately. So you're better not to use that at all versus because what happens is it moves the dust around. So if you want to get rid of the dust, you want a wet surface, something that's wet and moist that picks up all the dust particles.
And then I asked this because I use a Swiffer at home. I use like that, and I feel like it picks everything up because I see it at the end of the day. I see it right
but
on.
But it actually
it's
stirs
stirring
up
things
the air.
up.
So if it's a moist surface, one that's got a wet surface, it's fine. But most of them that are dry are actually going to do more damage than they are going to do good.
All right, so what do we have here?
So this is just to remind all of us that if we're going to exercise, again, you want to do that later in the day. Early in the morning, the pollen count is higher. If you really must exercise early in the morning, then what you want to do is do it inside. And another important thing is, listen to Chrissy and Brad and see what the pollen count is. Days where the pollen count's high, you probably do want to stay indoors. Close the windows, maybe put on the air conditioners if it gets a bit
okay,
dry.
Perfect. And real quick, before I want to get to this, okay? I'm going to skip over. So the peanuts, we're talking about peanut allergies, and now they say that there's a new pill that you can use, right?
Yes, fascinating. Kristina, unfortunately, about 1 in every 60 kids and 1 in every 170 adults have a serious allergy to peanuts. Some of them are actually life-threatening, as we know, from even a small amount. So they came up with they're working on a pill now, and they've researched this in 2 different studies. And what they did in these, they divided them into 2 groups. One group took a pill that had a small amount of peanut flour in it. And over a 6-month period, they gradually increased the dose of that in that group. In the other group, they just gave them what we call a placebo, which didn't have any peanuts in it. At the end of that 6-month period, they exposed both groups to 1 or 2 peanuts. They found in those that they actually had given the peanut pill to, 80% of those people had no reaction whatsoever to that peanut, whereas in the group that hadn't gotten the peanut pill, 80% of those people had a reaction.
So for parents especially, before they start using this or start giving it to their kids, they want to check with their doctors first, right?
It's early experimental, but I think the place of this pill, Kristina, might be for people that have life-threatening allergies. It may really make a difference for them.
All right, so here we go. Did you hear what he said? Get rid of your Swiffers. Because they don't work. All right, thank you, Dr. Chaffoo. We appreciate you. I'm going to send it back to you.